Hello. Hi. So good to be here across the pond and lovely England. And I want to say, first of all, the name of the talk, in case you're not sure, is called Realizing Transformation, that's Continuing Care and Integration in the Treatment of Addiction with Psychedelic Medicines. Okay, so make sure you're in the right place. And first of all, I want to say hello to everyone and fellow researchers. And oh, this is the good part too. It's the last one of the day, so I can go over. You like that? So fellow researchers and therapists, journalists, physicians, seekers, and all you magnificent psychonauts. Good afternoon to you all. I want to thank Ben Sessa, Dave King, and David Luke, and my friend Erica Bennett for all your support, and all the volunteers for all their hard work and devotion to make this thing happen. For assembling this inspirational gathering of the tribe here today. Very exciting to be here, and a lot of the same faces, of course, pop up in these things, but they're good faces, and there seems to be many, many more of us too, which is very, very good news, I think. So. Anyway, thanks, guys. And my deep sense is that our tribe is not only growing in numbers, but also expanding in global awareness. And in our commitment to allow these medicines to teach us their secrets, really. And it's a worldwide movement. Last September, I had the pleasure of participating in the World Ayahuasca Conference in Ibiza, Spain, where several hundred researchers, curanderas, and experienced journeyers from around the globe assembled and gathered to share knowledge and celebrate the venerated vine of the soul and its gifts. And this is very good news for all of us, I think. Last autumn, I was honored to be invited to speak at the Horizon Psychedelic conference in New York City. Over 1,000 paying participants constituted the international audience. And so I think we're witnessing a sea change in our attitudes toward these medicines. It is encouraging to realize we are not toiling alone. We are not working in a vacuum, be it the researcher in the lab, the therapist in the room with a patient, or perhaps one of us on a singular journey or walkabout in the desert or jungle or the mountains. So it feels good to give and receive support here as we embark on this very important work of self-discovery. So thanks to you all for being here this weekend as well. And here I must pause and briefly pay homage to the man for which this room was named, Alexander Sasha Shulgin. I'm going to get a little emotional right now, because I love Sasha a lot. And he died a year ago, and we want to give thanks to his wisdom and appreciate his wisdom. I first encountered Sasha about 28 years ago at the Esalen Institute in Big Sur, California. And I was in the hot baths, and coincidentally, and shocking to some, I had ingested some MDMA that evening. So I met with some friends. I was with some friends, actually, and unbeknownst to me, there was an MDMA conference going on there. I think my friend Rick Doblin was actually at that conference, I found out later. And I heard a man talking in a distinctive voice in the next bath, and specifically about MDMA, coincidentally. And others were saying, yeah, you're absolutely right, Sasha, as he's holding court in the baths there. It was then I realized it was Sasha, of course, and it was night and dark in the baths, and the man appeared to be standing, but he was actually sitting on the edge of a bath, on the edge of a tub. He's about 6'5", okay, so he looked like he was. And I told my friends, and I was pretty high at the time, and rather excited to see this great man. It was a long time ago, and 28 years ago, like I said. And I waited not so patiently until we both repaired to the showers, and I approached him, and of course I was buck naked, and I'm looking up at him like this, and I said, thank you so much. You know, I'm really high, and he said so beautifully, and I just like to quote this because it's great. I think, thank you so much for your work, for this amazing medicine you've given us. And he replied in his inimitable style, well, for some people, these things are like snake oil. But really, it's in you. It's already in you. And so Sasha continued his work, born of his innate curiosity, until his sad passing about 1 year ago. And he always maintained that the medicine was a tool for self-discovery and a recognition of our connection to the earth and to each other. So today, I'm going to talk just a little bit about, primarily about the plant medicine ibogaine, its potential as a catalyst for deep healing and transformation, and the subsequent and crucial integration of the lessons it can teach us. One thing I've learned from my work with ibogaine is that I don't know much. And so I think this is a good place to begin. As the great Zen master Suzuki Roshi said, with a beginner's mind. So there is so much yet to learn from this medicine and each other and ourselves. And I'm reminded of a lovely quote from Carl Jung, which seems appropriate and suits my mood today. He said, ignorance is never a recommendation, but often the best knowledge is not enough either. Therefore, I say to the psychotherapist or to the psychedelic medicine provider or participant, let no day pass without humbly remembering that everything has still to be learned. It is in this spirit of humility and respect that I encourage all of us to ask ourselves, really, how can we be ever more conscious and thoughtful in our personal inner work with these sacramental power tools? For those of us engaged in providing and guide others in these endeavors, may I suggest we ask ourselves, how can we become more effective in our work? How can we be of better service to those seeking a life with less suffering? How can we manifest integrity and compassion with those who seek our counsel? So if I may pose a question to you all, as an audience participation, how many of you are familiar with ibogaine? That's not bad. I expected more from this crowd, but that's... and how many people here have actually ingested ibogaine? That's about right, actually. Okay, so that's the conundrum that we face these days with ibogaine. It has been the ugly stepchild of the burgeoning psychedelic renaissance. And yes, LSD, psilocybin, ayahuasca, DMT, cannabis, of course, and oh yes, ibogaine. A common misperception is that it is dark, scary, dangerous, and definitely not sexy. But actually it is sexy, if real healing and personal transformation turns you on. And yes, as Humphrey Osmond so beautifully said, to fathom hell or soar angelic, just take a pinch of psychedelic. And I have to say, ibogaine is definitely a ride. It's a ride for those who haven't done it. Now, since not many of you know about ibogaine, I think I can indulge a little bit of history because we have a little more time. I wasn't going to talk about history because it goes on a while, but so a little background. Ibogaine comes from West Africa, primarily the area of Gabon, where the Bwiti people have used it for centuries as rites of passage and ways of communing with ancestors. Very powerful medicine in their world. It's also very much a group or familial activity. And so it was many, many moons later that an intrepid heroin addict and neo-bohemian by the name of Howard Lotsof ingested ibogaine. He heard about a new drug. He was addicted to heroin. He's in the East Village in the early 60s. Hey, there's a new drug in town. Let me try it. And so he tried it. And lo and behold, within 48 hours, he was no longer withdrawing or craving heroin. So he said, I got to give this to my friends. Okay, reminds me of the first time I did MDMA, and I did the same thing. I've got to try this. So he did that, and 5 out of those 6 friends, I don't know what happened to the 6th one, by the way, but 5 out of those 6 were no longer withdrawing or craving after a few days. So that's pretty exciting. That's pretty exciting news. That's miraculous. Okay. And I'm sure a lot of you already understand that. And, but first, I want to offer a warning, and this is something I'm telling myself as well. If after this brief talk or even years of working with the root bark powder ibogaine, you have the idea that you really have a grasp of or even think that you truly understand it, then you would have subjected yourself to a very serious hoax. There is so much we do not know and so much left to learn about this medicine. And as the esteemed neurobiologist and ibogaine researcher Dr. Ken Alper reminds us at the conclusion of every time he does a PowerPoint, and I've seen him do this many times, it's really beautiful stuff. He speaks in layman's terms about very complicated brain chemistry. But he always at the end, he comes up, he presents the question, so how does ibogaine work? And his answer, with the last slide, he answers clearly and succinctly in big bold letters, we don't know. We do know, however, what it does, okay? And that it absolutely interrupts the cycle of craving and withdrawal. Yes, it really does stop heroin in its tracks. It's a joke, heroin in its tracks. Had to wait for that one. So anyway, briefly, how did I get here? I was in a grad program in clinical psychology, and I found myself working in a pre-doctoral internship in a methadone clinic in Oakland, California. I had a 38-patient caseload, primarily serving an African-American population in an economically depressed area. Real belly of the beast stuff, for sure. And that was a tough gig, but I learned a lot there. And I was working with a population, actually, in which I knew very little. I'd always been into the fun drugs, psychedelics and stimulants, and but in moderation. But I always enjoyed those. So opiates were never my drug of choice, but this internship did pay real money, and as many of you undoubtedly know, when you're a grad student, any internship that pays money is a good internship. So I landed there, and they pay well because these methadone clinics do very well, So, it didn't take long before I came to realize, appreciate, and to care for and to honor these really gentle and beautiful people that I was working with, and love them, really. So, it didn't take long to witness the inherent cynicism in the methadone maintenance culture. You can even hear it in the name. Maintenance. They fully expected patients to stay on methadone for the rest of their lives. The clinics were basically getting paid by the government. And the idea is, we got you now. First one's free, little girl, And so the government, AKA the clinic, was the de facto dealer. Now, I want to be careful about this because I don't want to throw all methadone clinics into the hamper, into the garbage, because you know what, they do some good, and I don't want to just sound like I'm so negative about it, but I found it went against my core, it went against my grain, and so my attempts, and more accurately my simple conversations with patients, discussing even the possibility of tapering down their dose, or broaching the subject of getting off of methadone, completely and quickly made me persona non grata with the methadone clinic administration. So, as I said, it went against my nature from my training at California Institute of Integral Studies, at Esalen Institute, and my own personal journey, of course. So I had learned from those places and in my life that it's really possible to change. In fact, I wouldn't be in this profession if I didn't think that was possible. I know there's many psychologists out here who would agree with that we have to be able to change. That's what makes us human. That's what makes us evolve. So, anyway, not only was it harmful, but it was not helpful to be labeled an alcoholic or an addict, to be labeled that. Put them in a box. This is what you are. This is who you are. And so most of my patients, of course, had been hurt, rejected, and had been plagued with a very low self-esteem for most of their lives. So I knew there must be some other way. It was then that I first heard of ibogaine and its healing potential for those suffering with addiction, and also for those seeking psychospiritual cleansing. This is how I sought it, and awakening. So after some research and several inquiries, I found a provider in the East Bay of Northern California and personally experienced the root. And a dazzling journey it was. Sweetly and deeply connecting in the spirit with my late brother and my deceased father, who had passed earlier that year. And not long after my own inner journey, my old friend Rick Doblin, who's MAPS founder, are you in here, Rick? No, he never comes to my talks. He asked me to become principal investigator for MAPS pilot study exploring the efficacy of ibogaine in the treatment of opiate addiction. Quite honored, I quit the methadone clinic and moved to San Diego and began conducting research with patients at Pangea Biomedics in Playa de Tijuana, Mexico. It was there that I witnessed the power of this remarkable plant medicine to transform lives. And currently in my own practice, I use a variety of modalities to work with those suffering from addictions of many kinds. I use cognitive behavioral therapy. I use Gestalt, mindfulness, exercises to expand awareness, breath work, which is powerful too. Nature immersion. I like to take people out into the desert for a day, sometimes a couple days, as part of the treatment. I find that really useful. And it's good for me too. And occasionally when indicated, appropriate plant or psychedelic medicines. I use those when it's appropriate. It's not automatic by any means. By finding what works best though for the patient, we have had mostly positive results. I insist that patients be fully engaged in the process, empowering them to take responsibility for their own healing. The key element to this work with ibogaine or any psychedelic, in my opinion, is continuing care, aka aftercare, or integration work. I've tried to get rid of the appellation aftercare because it kind of implies an afterthought or an after party in some cases. So I think continuing care begins at the beginning of treatment. It starts the first phone call, the first thought you have about it. So as some of you know, this has been my work and obsession for several years, and it remains so today. This is exciting work because in my experience, it is the single best predictor for a positive or successful outcome for those using ibogaine to interrupt addiction. And what is a positive or successful outcome, you ask? Or maybe you don't ask, but I'm asking. It is whatever the patient says it is. And this is why setting goals and affirming intention are the key elements in an effective continuing care program. I always ask a new patient, first thing I usually ask them, how's the heroin working for you? They often respond with a shrug, as if to say, that's a dumb question, which it sometimes is. Then I may tell them, okay, it's up to you. You have to drive the car home to your own long-term health. Are you ready to drive? I engage new patients in this repartee for a reason. It's a little corny, I know, but it's for a reason behind that is because I want them to really own their choice to do this work. I really prefer not to work with somebody who's coming kicking and screaming. I don't really want to work with them. That's just my choice. So as many of you no doubt have come to realize, without intention and preparations, our patients do not fare as well. So my former professor and eminent psychologist and psychedelic pioneer, Ralph Metzner, he taught us all about the importance of set and setting in working with psychedelic medicines. And our preparation, or intention, if you will, is that in actuality, our attitude toward meeting these medicines with clarity and reflection can be a powerful indicator of its long-term impacts on our lives. It is of vital importance, in my view, to serve your prospective patient journeyers and yourself if you're doing this work, by the way. Not everybody here is a provider or a caregiver. By helping them or yourself to visualize their intention with a simple healthy diet, developing strong, well-articulated intention, becoming familiar with the ibogaine experience through reading and research, and by informing them as much as possible about what to expect, by taking time for self-reflection and for self-inventory where they can set actual goals. And also several sessions, if possible, with a highly experienced ibogaine counselor or therapist. Someone who is familiar with the terrain, the landscape of the journey. Often this may be a difficult challenge for both the patient and the provider, especially with a client uber-marinated in opiates, but in my view, it is well worth the effort for positive long-term results. A couple of little quick stories. Recently, I worked with a young patient, a 21-year-old young woman, both of her parents therapists, by the way, who had been using for 5 years. We prepped and met in sessions for 2 months prior to her, for 2 months prior to her trip to Mexico, which I am affiliated with a clinic down there. And, but her energy was absolutely distracted. I just didn't feel she was on board completely. Moments, yes. She said she was ready, and her long-suffering parents were ready for her to be ready. After many years watching and enduring her struggle, I suspected she was not quite in the best place energetically and developmentally, was really still a 16-year-old, even though she was 21 in actual years. The age she began using heroin was 16. But we proceeded anyway, really against my instincts, frankly. But I did it, we did it. Airline tickets to Mexico were purchased, plans had been made, and so we went with her parents, who were both therapists, as I mentioned. And I received this email from her mother from the ibogaine clinic in Mexico. Both her parents went down there with her, which I thought was great support, you know. On the 4th day, this is her mother writing me. When I read this, it brought tears to my eyes. It was so beautiful. On the 4th day, we journeyed up the mountain to see her. Weak and very still, our daughter beheld us from the hammock with the most clear and present look. A look, quite frankly, we had never experienced before. Not only did we have our daughter back, but we had a new daughter, mindfully aware and present. I saw the very same clarity in another iboga companion in the next bungalow. I cannot describe it, but it was palpable. We sat quietly together, gazing over the garden. Butterflies of all colors wafted by us, threading their tranquility in and out of this new family fabric. I had always longed to be in a Garcia Marquez novel. And suddenly I was. The languid white butterflies, as big as grapefruits, seemed to escort us as we walked to a private part of the garden. And then the provider who's there, my friend, Barry, said, her addiction is absolutely interrupted. I can guarantee that. Her provider stated, and her name was Annie, that's not her real name, agreed. A hard-fought war ended. Now the reconstruction begins. That was her mother's letter to me. 10 days later, after returning home, she was arrested for theft and was using again. So that's a bit of a cautionary tale, and I share that with you because it was another big lesson for me. Okay. And yet I want to emphasize that this is only the beginning of her long journey towards wholeness and health. I think once you're on that path, even if you get a little glimmer of light, you're not going to get off of it. I believe this. I've seen it. I also recently had a patient visit our clinic in Mexico with 3 solid months of preparation after 12 years of heroin addiction. He has returned home opiate-free, now only moderately using cannabis on a daily basis. Or harm reduction, by the way. Changing addiction behavior is often a complex and complicated process for both client and therapist. What seems to work best is the development of a strong therapeutic alliance. I saw this at my research in Mexico. That connection is hard to talk about in terms of research data. It's there, though. It's real. And so the right fit between client and treatment provider is crucial, in my opinion. And the role of the harm reduction therapist is closer to that of a guide, someone who can provide support and guidance throughout the difficult journey. The therapist guide offers validation and respect for each client, along with willingness to meet the person where he or she is on the journey and help them achieve the next step toward their goal. I love what my brilliant and compassionate colleague and brilliant and compassionate colleague and dear friend of mine, by the way, is Catherine McLean, has to say about intention, describing her work and research with psilocybin. My pet theory for treating addiction, she says, is that psychedelics amplify and consolidate intention. The power of intention, setting your mind to something, is huge. This is probably why spiritually oriented people tend to have such profoundly spiritual and meaningful experiences on psychedelics. But committing to an intention and sticking to it is actually really hard. In my experience, directed preparation, professional therapy, and regular awareness practice, this is Catherine still talking, meditation and yoga, help establish and maintain a deep intention for change. When most people say they want to quit something, they say it from their head, they rationalize it. But intention, one that lasts, comes from the heart and the gut. Luckily, this is right where the mushrooms, and I would add, ibogaine as well, like to communicate with humans. Catherine also adds that I hope that this study, her study with psilocybin, actually at Johns Hopkins, she was a part of, wonderful study, is a reminder, serves as a reminder to us all in the psychedelic community that psychedelics do not treat addiction without intention. Through research and experience, we have seen that the source of most addiction is born from the trauma of an emotionally empty childhood, some disconnect early in life. This is borne out by almost everyone that I know that works in this field. It makes it more of a relational than a medical problem. And such a groundbreaking, some might say radical, thesis of cause strongly suggests the need for real human connection rather than traditional one-size-fits-all, cookie-cutter treatment as the best practice for a positive outcome. I know a clinic in Baja, I won't mention their name, where they have a nominal aftercare program where the life coach, with no ibogaine experience by the way, uses what she calls a system approach to their clients. A paint-by-numbers therapy, in my view, has no place in post-ibogaine treatment. To be effective and compassionate, we need to meet each patient right where they are. Ibogaine's long-acting, maybe some of you know about ibogaine's long-acting metabolite noribogaine. Well, it remains in your body for a period of several weeks post-treatment. And what we've seen, which is remarkable, is that the ability to transform oneself, the ability to think that one's capable of change is upped 100,000%. And so this noribogaine acts as a powerful antidepressant, and it alleviates what's called PAWS, it's post-acute withdrawal syndrome, which is very common because you have that peak valley. Okay? And it helps replenish destroyed or desensitized dopamine neurons as well. This is a ripe time for personal change, transformation, and patients often say to me after their treatment journey, I believe that anything is possible. Now, for the first time in memory, I feel capable of real change, as I said. And this is where a strong relationship with the provider and or therapist is invaluable. If you plan to remain abstinent from addictive drugs, you absolutely must take some sort of action and utilize the foundation that ibogaine has provided. After your journey with ibogaine, if you go home to the same environment in which you were abusing drugs, changing nothing, and doing nothing, then very soon it's extremely likely you're going to be right back where you started. This happens. It is not a miracle cure. I want to make sure that's very clear today. It's very important. Psychedelics, as we all know, are a tool for transformation. They are a tool like a telescope or a microscope, an amazing and revelatory tool. And as such, they deserve our respect and care. With psilocybin or ibogaine or other psychedelic medicines, it is also important to remember that, in my view, these amplifiers are tools in the tool belt. They are not the house being built. As my dear friend, ibogaine researcher Patrick Krupa has said in referring to addiction treatment, ibogaine is a catalyst, not a cure. Very important. Catalyst for personal change and transformation. The same goes for mushrooms and other psychedelic medicines. With deliberate and honest research and intention, we can use these wonderful tools to allay pain and relieve suffering, and to rediscover our birthright for fulfillment and joy in this wonderful life we have been given. I want to close with these words from Terence McKenna, because I like these words. And I think they're beautiful. And I won't do my Terence McKenna imitation. I won't do it. Maybe after. Maybe. I always say that. And nature loves courage. No. You make the commitment, and nature will respond to that commitment by removing impossible obstacles. Dream the impossible dream, and the world will not grind you under, it will lift you up. This is the trick. This is what all these teachers and philosophers who really counted, who really touched the alchemical gold, this is what they understood. This is the shamanic dance in the waterfall. This is how magic is done, by hurling yourself into the abyss and discovering it's a feather bed. Thanks.